Hello and welcome to my podcast, Cass and Tell. Our episode today is called The Good, the Bad, and the Unknowns About GLP-1s. My name is Cassandra Meredith. I am a mother, wife, and registered medical assistant for a primary care office. I live in the beautiful state of Montana and love being surrounded by beautiful views everywhere I turn. Today, we will be discussing the widespread embrace of GLP-1s and their benefits and risks. I went to a couple different sources, a family practice physician, Dr. Elizabeth Jaffe, MD, who has had her fair share of prescribing these medications and knowledge surrounding these medications. I also will be talking with Kate Tresselman, a pharmacist that has a lot of knowledge on the benefits and risks of GLP-1s for diabetics and patients using it for weight loss. The last person I will be interviewing is my sister, Amy Downey, who is currently taking a GLP-1 for weight loss. The first subtopic I will be discussing on GLP-1s is the information and history behind them. GLP-1s have been around for a lot longer than I had realized, dating all the way back to the 1970s. In 1970 is when scientists started trying to develop a GLP-1 in the lab. Starting in the 1980s, they compared genes from anglerfish, rats, hamsters, bovine, and humans to figure out how GLP-1s naturally occur in the body. The first FDA-approved GLP-1 was Byetta in 2005, and it was only approved for patients with type 2 diabetes. From there, researchers kept creating more GLP-1s that would later have benefit of not only improving your diabetes, but causing weight loss as well. Per Brian Bunce, with Drug Discovery Trends, from 2021 to 2023, the company cemented its position as the fastest-growing big pharma player, reaching a 35% year-over-year growth rate in 2023 and 74% growth from 2020 to 2023 when measured in U.S. dollars. GLP-1s became so popular that the sales skyrocketed once they found out a benefit of the drug was weight loss, which ended up creating a shortage of GLP-1s. The GLP-1s that were specifically made for diabetics were bought by patients who were not diabetic and only wanted the drug for weight loss reasons. Because of this issue, pharmaceutical companies started coming out with GLP-1 forms specifically for weight loss and specifically for diabetics. For example, the FDA-approved form of semaglutide for weight loss is Wegovy, and the FDA-approved form of semaglutide for diabetes is Ozempic. For subtopic number 2, I will be conducting an interview to get a family practice physician's perspective on GLP-1s. I will be conducting an interview today with family practice physician Dr. Elizabeth Jaffe, MD. I have worked with her for 2 years at a primary care office as her medical assistant. We have become great friends, and every day I'm so impressed with her medical knowledge and the care she has provided for her patients. So let's get to know her a little bit more before we jump into questions regarding the GLP-1s. First and foremost, do I have permission to record our interview today for my podcast?
Yes, you do.
Where are you currently practicing medicine?
I currently practice in Kalispell, Montana.
Where did you attend medical school?
I did both medical school and residency at the University of Nevada, Reno in Reno, Nevada.
How many years have you been practicing?
22 years.
Wow. What is your favorite part about being a family practice physician?
As a family practice physician, we really get to help patients live their best quality of life possible, and I love talking to them about what their goals and aspirations are and then helping them attain those goals.
Dr. Jaffe, I'm going to be asking you questions today on GLP-1s. We will be weighing the risks of GLP-1s and their impact on society for patients who want to take it for their diabetes and for patients who also would like to take it for weight loss. So my first question is, what are GLP-1s?
GLP-1 stands for glucagon-like peptide 1, which is actually a hormone. And so the drugs mimic this hormone. The goal of this hormone is to lower blood sugar, but it also decreases appetite in a feedback loop, tells your brain that you're full, and therefore that results in the weight loss.
Why do you think some diabetic patients refuse insulin therapy for years, but are eager to try GLP-1s once they become available?
I think the number one reason is fear with the insulin. They are very scared about injecting something into their body. Traditional medications are usually a pill that you take by mouth. And insulin is a daily injection. Sometimes they have to inject up to 4 times a day. And so that's really burdensome for the patient. GLP-1 is a weekly injection. And so I think they're more willing to accept that more limited amount of times that they have to inject something than they do with the insulin.
Have you noticed whether patients' quality of life or their motivation changes when they switch from an insulin to a GLP-1?
Yes, I think they do have a better quality. They have a better outlook on their goals for the treatment. With insulin, really the main goal is to just decrease your blood sugar, and a lot of patients will actually gain weight with insulin. On the GLP-1s, they see their blood sugars decrease as well as their weight decrease. And when their weight decreases, most patients feel better. They feel better about themselves, and they can look in the mirror and see that they're improving their health when they see the weight loss.
Why do you think some people are willing to start using GLP-1s primarily for weight loss despite limited knowledge about long-term side effects on them?
Well, weight loss is a really hot topic right now. It really always has been. And I think people feel best about themselves when they are at their ideal body weight, or at least close to it. And so I think that they are more willing to take risks, to feel better about themselves, look good, and to see a potentially healthier future ahead of them.
Patients seem hesitant about other injections, for example, insulins or vaccines, but do they seem to have the same hesitation with GLP-1s?
Some do, but the willingness is surprisingly more likely when dealing with the GLP-1, for what we would consider more of a cosmetic outcome for patients. They seem to be more willing to try something for that than for medical indications. And I think, again, it's kind of the societal values and the outward appearance that heavily influence patients to try something like this.
How do you approach conversations with patients who want to start GLP-1s mainly for weight loss rather than for medical reasons like diabetes?
Well, the first thing I tell them is that without a diagnosis like diabetes, the medication most likely will not be covered by insurance. The second thing I tell them is that this treatment is most likely a lifelong commitment. Really, like any diet, if you go off of your diet, you most likely will regain the weight and your appetite will come back. And that is true for these medications as well.
Do you think insurance should cover a GLP-1 with a diagnosis of weight loss?
For the right patient, I think they should. We have patients with morbid obesity that affects their sleep. They can have sleep apnea, which can cause more comorbid conditions. They are starting to cover it for some patients with different cardiac conditions. But for someone who wants to lose 10 pounds in order to look better in their clothes, I don't know that this is a great long-term option for just a minimal weight loss like that.
What role do you think social media plays in the shaping patients' attitudes towards new medications like GLP-1s?
Well, social media is a very heavy influencer. Not only does it keep the topic constantly in your mind, it usually promotes either the mostly good or the mostly bad aspects, depending on who's doing the posting. And right now with social media, it's usually the companies that are trying to sell the drug. And so they're promoting all the positives, and it's constantly in your face. And I think it makes patients more willing to try.
What is your approach for helping patients understand the risks and benefits of new medications? And that can be any medications, but for example, GLP-1s.
Well, first, I like to validate their desire to try to improve their health. I think that is really important, that they take a stance on how much they want to give for their own health care. And I like to explain the pharmacology behind how these medications work, what they can expect from the medications, and that includes the costs and the side effects as well.
Are patients more willing to tolerate significant side effects from the GLP-1s more so than other drugs?
It seems so. I have a lot of patients calling to change their blood pressure medication or their cholesterol medication based on potential side effects that they either have or even read about. And they'll say things like they want to try lifestyle changes first and they really don't want to take the medication I've prescribed. And on the flip side, with the GLP-1s, I usually have to ask if they're having any side effects. And I commonly get patients who say that they do. They get a lot of nausea or heartburn and reflux, but that they are willing to accept those side effects in order to see the benefits of the weight loss.
With all the information and major side effects that are coming out now for the GLP-1s, like thyroid cancer, acute kidney injury, potential retinopathy, etc., do you think it's safe for patients to be able to take long-term?
At this point, we really just don't know. That is going to be seen with time as more and more patients take these drugs for longer and longer. There was a weight loss drug back in the 90s called Fen-Phen. That was all the craze, much like the GLP-1s are today. And after a few years, they actually had to pull that drug from the market for cardiac side effects. And so I do sometimes worry at some point that they may find there are more side effects than we thought about. We have prescribed these drugs a long time for diabetics, and patients have tended to do well on them long term for that. So I'm hoping to see the same thing for weight loss.
Thank you again for your time today and sharing all of your thoughts on GLP-1s. I really appreciate hearing your perspective on the GLP-1s that are being used for both diabetes and weight loss in a primary care setting. This information has been very helpful and educational regarding the topic of GLP-1s.
Absolutely.
For subtopic number 3, I will be talking about mental and emotional health with GLP-1s. When I bring up the mental and emotional health aspects of GLP-1s, I'm not talking about the potential side effects while taking them, although those do not help. I'm talking about what compels us to take this medication with very little long-term information just because it helps us lose weight. I'm not presuming that all patients are uninformed. There are some patients who do their own research before requesting a GLP-1. However, a lot of patients that I have encountered knew nothing about it other than the weight loss benefit before requesting to be on a GLP-1. Now, this could be a stretch, but I relate this to our mental and emotional health, and I will tell you why. This is informed by what I have personally experienced while being a part of patients' medical care at the clinic I work at, and this was slightly discussed in my interview with Dr. Jaffe. Why are some patients unwilling to be on a cholesterol or blood pressure medication, for example, because of what they read online about them, or because of minor side effects they have experienced, but are willing to put up with some significant side effects with the GLP-1s? Researching GLP-1s yields scary effects they are seeing like thyroid cancer, blindness, and acute kidney disease. Additional minor side effects being Ozempic face, which is when you lose all the good fat in your face and your face sinks in. The other side effects include nausea, vomiting, diarrhea, etc. However, patients even knowing this or experiencing these side effects still want to be on a GLP-1 so they can see a change in their appearance. The mass excusing of these side effects really says something about society today and what role social media plays. When I first heard about Ozempic, it wasn't because I work at a doctor's office. It was from social media advertising all the beautiful celebrity women who are taking it for weight loss. Pharmaceutical companies pushed hard on the advertisements about how GLP-1s were magic drugs to make you lose weight and did not require any lifestyle changes. It wasn't until I started working as a registered medical assistant at the clinic I work for that I found out that GLP-1s were initially made for diabetics. GLP-1s have a whole laundry list of risks and side effects as well. Notice how these negative side effects were not advertised as much on social media, other than the socially constructed idea of beauty. For subtopic number 4, I will be conducting an interview to get a pharmacist's perspective on GLP-1s. Today I'm interviewing Kate Tresselman, who is a pharmacist. I've worked with Kate for 3 years at my clinic, and I have always went to her for questions regarding diabetes and GLP-1s and how they get approved for patients. All the providers in the office will go to Kate for her advice on things, so I know she's a perfect person to interview. So let's start by getting to know you, Kate. Where do you currently work as a pharmacist?
Yeah, I'm currently at Logan Health in the hematology oncology clinic as a ambulatory care oral oncology pharmacist.
Where did you go to pharmacy school?
I went to pharmacy school at the University of Washington in Seattle, Washington.
How many years have you been a pharmacist?
Oh, I guess 15 now.
Oh, wow.
Yeah.
What is your favorite thing about being a pharmacist?
I like that I can combine medicine and education to help both patients and then people I work with.
All right, now that we know a little bit more about you, let's hop into questions regarding the GLP-1s. So first question, from your standpoint as a pharmacist, what is the biggest benefit you see with GLP-1s?
I think probably it has to be the long-term benefits. So the big ones are the cardiovascular health and helping your heart. And then obviously the weight loss benefit. And then I think for diabetes, the A1C lowering and blood sugar improvements. So long-term, that helps a lot of other things. And then the newest things coming out are with NASH, which is non-alcoholic fatty liver, and the potentially beneficial effects on the kidneys as well that are being studied. And then one really hot area right now that's getting a lot of press is addiction. They may be used in the future as a means to help with addiction.
Can you explain how the GLP-1s work in the body?
Yeah. So this is right up my alley as a pharmacist, okay? So there's 4 different ways, okay? The first way is, and the major way, is by delaying gastric emptying. So the stomach contents don't move as quickly through the GI tract, making you fuller faster. And so that makes you eat less, obviously. And then it works, number 2, with the brain to send an early satiety signal from the brain to the stomach, telling you not to eat as much. And then in terms of the diabetic potential, it stops the pancreas from secreting, it helps the pancreas, I should say, secrete insulin when you have a meal, so it's food dependent. And then it actually stops the release of sugar stores in your liver, or glucagon from your liver, when you don't need it. So those 4 things.
Awesome. What is the most common side effects you see with the GLP-1s?
Because of the mechanism and how they work, unfortunately, it's usually all gastrointestinal related. So nausea, indigestion, upset stomach, burping a lot as well, and then constipation, but some people have diarrhea as well.
Okay.
But it makes it kind of hard to tolerate. Some people do well, others, have a lot of issues and we can't continue them.
Are there certain patients you would not recommend them for?
Yeah, anyone who has GI issues in the first place, okay? So people that have severe issues with gastroparesis, this is going to just, make it more difficult for that kind of flow through the colon and rectal area.
Okay.
And then, people who do not want to lose weight, because one of the benefits or side effects of this medication is weight loss, they may not be the best fit for that as well. And then from a pharmacy standpoint, we avoid it in people who have had a rare type of thyroid cancer, and then also retinopathy, because it can very, very rarely cause retinopathy And finally, pancreatitis. So anyone who has had issues with their pancreas, and then gallbladder too. All reasons to avoid.
Okay. Do you see a trend of patients staying on a GLP-1 long term, or do they struggle to stay committed?
That's a great question. So it depends upon why they're on it. I think it's easier for those people who are diabetic because we tell them about the long-term benefits. If they go off the medication, they don't see those same long-term benefits. Whereas if you're using it for weight loss, depending upon if you're able to make those lifestyle adjustments with it, you may not have to use it as long, but right now, the studies show that you are supposed to continue it to see those benefits.
Okay. Do you think GLP-1 should be a temporary medication or a lifelong medication? And that can be, you can go off on both, what you feel about diabetics versus weight loss, because I'm sure that's two different answers for both.
Yeah. With all these long-term benefits that we are seeing in those clinical trials, you'd like to say that it could be a lifelong therapy, because like we talked about, if you go off of it, then you kind of cancel out those benefits. So it's turning into that, and when we counsel and talk to people about that, we do say, hey, once you start this, we really don't want to take you off of it. And so if you're looking at it from a weight loss standpoint, if you want those added benefits, then you need to stay on it too, not just for the weight loss, but other things. And so we're seeing a trend of once people have achieved their goal, what we're trying to do is reduce them down to the lowest effective dose, or the lowest dose interval-wise possible to give them, so they can still get that benefit. Now, that being said, there are some people who can come off these medications for weight loss if they have made the proper non-pharmacologic adjustments as well.
Okay. From experience with working with patients that want to try a compounded GLP-1, do they work well compared to an FDA-approved GLP-1?
So that's a great question. And if you would have asked this question when everything was coming out, so the GLP-1s, you have dulaglutide, which is Trulicity, and then semaglutide, which is Ozempic, and then liraglutide, which is Victoza, and those are the main ones that are out on the market now. The other ones have kind of fallen out of favor. And the reason why those three is they are the ones that have been studied and shown to have those long-term extra benefits that we talked about. So those three, when there was a huge shortage of all of those, that's where the compounding pharmacies came in. They were able to get, hopefully, the active ingredient from a reliable source, and then sell that ingredient during the shortage, and compound that ingredient for people with other things, with vitamins or a different dose, or just because of the shortage, they were able to do an FDA-approved dose.
Right.
The question is, where were they getting that medication if it was on shortage everywhere in the United States and we couldn't get it from the approved avenue? Where were they getting it, and was it counterfeit? And what's legitimacy of that? I think there was probably a lot more black market stuff happening back then, but now I'd like to say the compounded products are much more regulated. However, it still begs the question, is it safe and effective? And I back then, I couldn't tell you. And that's the thing now. With compounded products, there are not necessarily big, robust studies to show that adding something in or switching to a different dose is safe and effective. So we can't necessarily guarantee that.
Right.
So it's really reserved for when you have failed the FDA-approved indications, or you have a specific reason why you can't use that FDA-approved medication.
Or if it's like a financial issue, wanting to get a cheaper alternative.
Yes.
Because I feel like that's where
Yes.
a lot of people go. I know when I did some research, that was a big thing with the compounded, is they replaced it with a salt version.
Yes.
Which they were not finding was appropriate. And they were finding a lot of pharmacies that were counterfeiting and that were, almost kind of
taking advantage
of these people because they knew that these people wanted it that badly during this shortage.
Yes.
So that's pretty interesting. Knowing what you know now about GLP-1s, do you recommend them more than insulin therapy? I know you more talk about it on the insulin therapy more than anything else.
Yes.
But I'm curious to see what you think about that.
So I think up front you have to be telling the patient and people about the risks, and then also that this is usually a long-term medication. It's not something that you stop. It's something that you can continue. But because of all those added benefits we talked about, that the cardiac benefits, the biggest one, really we have been pushing those more because they have better evidence. Insulin, you gain weight. Long-term, you become insulin resistant. And so there are a lot of problems and risks associated with insulin therapy as well. And so it's trying to find that happy medium, but also getting those long-term really great benefits. So again, all of the guidelines now in guideline-directed care and evidence-based medicine really suggests reserving insulin in those patients and using GLP-1s or SGLT2s first line, depending upon a person's other chronic conditions or comorbidities.
Okay. Have you heard that there is a pill form of GLP-1s that are coming out? And how might this change things for patients if you've done some research on it?
Yeah, that's a great question. There actually has been a pill available for a while. It goes under the brand name Rybelsus, yes. And then there are more that are coming out, and there are also combination therapies with a GLP-1 and GIP.
Oh, wow.
And so the one is injectable right now, but I think they're coming up with other oral versions. And I think it makes it more convenient. However, what we know about the current one on the market, it also has more GI-related side effects. Tolerating and getting that pill in and then having to take something daily can be complicating as well. But who knows, maybe they'll be weekly pills. I think the convenience factor is nice, but I just worry sometimes about the side effects. We'll have to see what the studies show.
Do you think the new pill form will be more affordable compared to the injectable form?
Definitely not. Unfortunately, the drug companies have to recoup their R&D costs, which we understand. But it would be nice to just have a restructuring of the whole drug pricing system in general. There's no reason that these medications need to be this expensive, both injectable or oral.
Do you think they originally did it when there was the shortage and then it just never went back down, or have they always been
they've always been kind of expensive. The first one, to my knowledge, came out in 2005. And, so we do have 20 years of use of these medications, which it's nice. However, they've gotten really mainstream popular, I'd say, in the last 5 years, especially with those new indications.
Well, and from my studies, when kind of around COVID time, 2021 is kind of when semaglutide was, brought out with the Ozempic. Mm-hmm. And that's when they really started seeing the benefits of the weight loss, and when it started becoming more than just a diabetic drug and people were getting more interested in that.
Right.
So I saw that there was quite a spike from 21 to 2022 from then. Because, we've had it around. I think I read that it was back in the 1990s that we even have had this around. Just no one has really heard about it.
What's really interesting is that the original molecule, it came from research on the Gila monster. So that's where exenatide came from. And then we have been able in labs and through research to create, synthetic forms of it that are better tolerated.
Do you think the demand for GLP-1s has created shortages and affected diabetic patients who need them? I know we kind of already touched on this so far.
And now we're back to normal, but previously, yes, there was a huge shortage back in 2022, for sure, 2023, that affected people who relied on these medications for blood sugar control and those long-term benefits. You saw the Hollywood stars promoting these. And so people who needed them for weight loss, either appropriately or inappropriately, the bulk of that medication was kind of shifted towards that. So then you left these diabetics kind of in the dust. And not to say that obesity is not a huge problem as well, and people could, it causes death, ultimately, and complications. So there are certain subset of patients for which they need it probably just as much as a diabetic patient would need it. But there are also patients using it, off-label for inappropriate reasons too.
Well, and Dr. Elizabeth Jaffe kind of touched on that too. She had said one of the things I really don't recommend it for weight loss for is for people who only want it temporary. And so in the sense of 3-month time span, I want to lose 10 pounds or 20 pounds before my wedding or before the summer. To her, that was deemed as inappropriate because for it being such a short-term use, the benefits versus the risks just weren't worth it.
Well, and that's a really good point, actually, because you won't even see those benefits as you have to titrate up the medication, and you do that monthly. And the highest weight loss was seen at the highest dose. So it takes at least 4 months to get to that. So yeah, there's no point in trying it if you're not going to be on it for greater than 4 months. I would say 6 months to a year, and really I would say you need to be committed even further.
Right. Do you find that diabetic patients choose a GLP-1 over insulin therapy when they are given the option?
I think the majority of them do once they're educated because of those cardiac benefits and other benefits. Mm-hmm.
Right. And what a life changer too, to not go from having to do insulin every day to being able to go to just once weekly.
Yeah. Well, and you see people, maybe they have to be on both for a while, but as you titrate up the GLP-1 medication, you're able to get people off insulin. And then they learn those healthy habits due to the mechanism of the GLP-1. And then maybe they can go down on the dose, or, their A1C number, their hemoglobin A1C goes down to the point where, they don't have to be on as many medications and don't have as many complications related to the disease.
From your research and what you have seen with your own patients, do you prefer a GLP-1 for diabetics versus insulin therapy?
So do you mean putting them on a certain GLP-1 or insulin versus GLP-1?
Versus.
Okay.
And it could be any GLP-1. If you're looking at ones that you have your specifics, that's fine. But in general, do you feel that from what you've noticed from the A1C differences even to the other benefits, do you feel like you really prefer it now over insulin therapy, or do you kind of still stay with both?
So that's a really good question, and it really is dependent upon where their A1C starts. So anyone who has an A1C over 10, or if they're in the 14s, 15s, you really need something that's going to be quick acting. GLP-1s are not quick acting. They take months to drop the A1C, okay? So you have to, it's almost, negligent not to start someone on an insulin. And you could start the GLP-1 at the same time, but while you're working to get the blood sugar down quickly with the insulin, you can ramp up the GLP-1 and then hopefully use that as a bridge to get the insulin as a bridge to get off the insulin and just on the GLP-1. But because of the long-term benefits, for people who have more well-controlled A1Cs, 7, 8, 9, under 10, really all the evidence and the guidelines push us towards GLP-1. So that's what I've been doing in my practice. However, for diabetics, I would say it depends, again, upon their other chronic conditions. So we don't just use GLP-1s. The other class up there is going to be those SGLT2s, which are dapagliflozin and,
Well, honestly, I don't think I've done any research on those.
Yeah, so dapagliflozin is Farxiga, and then the other one is Jardiance, which is, and I'm forgetting the generic right now.
Okay, and what is the name of it?
They are SGLT2 inhibitors, and they work by, for diabetics, by causing them to excrete extra sugar in the urine, okay? And what they have is the same cardiac benefit, potentially, heart failure benefit, and chronic kidney disease benefit.
Oh, wow.
So those agents aren't just approved for diabetes, they're approved for people who have heart failure and then people who have chronic kidney disease as well. So they have more, evidence. However, you really want to go based off of what a patient's conditions are. So if a patient doesn't have heart failure and they don't have chronic kidney disease and they're overweight, well, that pushes you more towards the GLP-1.
How can you explain the dosing difference in diabetics versus weight loss for the GLP-1s? Because I know that weight loss is a little bit different on how they titrate up versus diabetics.
Yeah, so the titration is kind of the same, but the titration amount goes up higher. Okay. For the two that have been FDA approved for specifically weight loss. Mm-hmm. Well, there's 3. But we kind of forget about the liraglutide, which is Victoza, because it's a daily injection in diabetics, and then also our Saxenda, which is the indication for weight loss. It's daily, and so not a lot of people want to take a daily injection.
Right.
So basically what they did is they pushed the dose slightly higher in that group of, it would be the Wegovy patients, or the Ozempic would be the brand name for the diabetic indication.
Okay.
And that's where they're seeing, again, like we talked about before, that the higher you push the dose, the more the weight loss. And that's where it comes from.
And this is just coming off the top of my head, so I don't know if there's any like medical thing to this.
Mm-hmm.
But for people who are strictly taking it for weight loss, and their A1Cs are already low, can that make it to a point where it's dangerously low, or does it not affect it if it's a different type for the specific weight loss?
That's a great question. So we think about it in terms of the side effects, and hypoglycemia or low blood sugar is not really a side effect of these GLP-1s. Okay. So usually we don't have to worry about that going very low. Maybe there's a case study about it, but in the clinical trials, they did not see that as a problem.
Okay, cool. Lastly, as a pharmacist, what advice would you give to patients who are considering new medications and vaccines in a world full of conflicting information? And I ask this, I kind of asked something similar with Dr. Elizabeth Jaffe, only because from my experience with patients, what I've seen with like blood pressure meds or cholesterol meds, they may not want to try those because they read up on them and they're like, I don't like what online says about them, or I don't like that they give me a cough, or something that can be considered a minor side effect in sense of like the whole picture. But when it comes to a GLP-1, and this can be for diabetics and weight loss. But for a GLP-1, people are tolerating, even with them having these full gastro issues, like the vomiting, the diarrhea, the nausea, I find that they're still willing to be on that with those symptoms, knowing what is going to come to them, almost like the benefits that they're going to get from the GLP-1. So it's interesting to me to see, like, they're willing to risk these symptoms with a GLP-1, but they're not willing to risk potential symptoms with like a vaccine or a medication that they may need for their cholesterol if they have a super bad cholesterol or potentially high blood pressure.
Well, now what's interesting is we have access to so much information. So you'll hear, the most common thing I hear is, I've done my own research, or, I was online and I did research. And I think you have to bring it back to, there's a lot of misinformation out there available. And there is a reason that healthcare providers have gone to a lot of schooling to hopefully help make that decision and separate the misinformation from the real clinical evidence.
Right.
And so I think it's very important before you make a medical decision to consult with your provider, your healthcare provider. And it can be a shared decision making. It doesn't, generally the healthcare provider listens and, talks about those risks and the benefits. They can go as in detail as need be. They can present the clinical trial data to you and maybe bring it down to a level that you can understand depending upon your education level as well. So I think that's really important to to talk to your provider about it. And then if you don't find a provider that shares the same views, you can always look for a different provider too. But I'm just very wary right now of all the misinformation, and especially the information that people get from social media. So I think it's important. Yes, you can do your own research, but always bring it back to that healthcare provider to help you make that final decision and what's best for you. Because it's individualized, right? It's not, when you're seeing all this information out there, that's one person's experience, or maybe that's one center's experience. But that's the beauty of these clinical trials. Usually that we base all of the medication approvals, whether they're vaccines or elsewise, we have these randomized controlled trials, we call them, from multiple centers across different cultures, different countries, different types of people, so that we can try to apply that to the general population, okay? But let's say our community is specific and has, more of one race than the other, has more males than females, or vice versa, or age differences. Well, then all of that has to be taken into consideration. And if you, as a patient, can apply that evidence to your situation, and that's where your healthcare provider comes in.
Right.
They individualize it for you.
And I do really feel like it is important for patients to do their own research, but equally as important after doing your own research, like you said, to go back to your healthcare provider, bring up what research you have done, and then talk about it. Because at the end of the day, things might get missed during questions that you might have on something you want to try. And with any medications that are new to you or vaccines, it's very important to have all the information that you need on them before you start anything, and not just going into it because you hear one benefit to it. It's very important to know the risks, the long-term potential risks, and the benefits to everything that you may stop or start, or anything else in that matter. But thank you so much for the time you took out of your day to inform my listeners about how GLP-1s are changing the game in medical history. Sounds like it might not be just a typical trend, but for some a life changer. It has created many positive opportunities, but for some patients it has created real challenges as well. I think it is important for patients to have all the information before starting the medication so they can outweigh the pros and cons to see if it would be best for them, while also considering that their body may not like the medication causing unwanted symptoms. And again, more important to go back to see your healthcare provider to make sure that it is a medication, knowing your history, that is appropriate for you. It was nice to hear a pharmacist's perspective today and some of the science behind it. So thank you very much.
Thank you for having me.
For subtopic number 5, I will be going over the weight loss side of GLP-1s. A big question right now is, should GLP-1s be used for weight loss? However, I don't feel like it's a black and white answer. In many ways, I feel that GLP-1s for weight loss have been beneficial, especially for those at a very high BMI that are suffering from comorbidities that need to lose the weight fast. Dr. Jaffe and Kate Tresselman have mentioned how GLP-1s have also been proven to have cardiac benefits, so that can be one comorbidity it can help with on top of weight loss. GLP-1s are not recommended for people who want to be on it short term to lose weight and to get their beach body ready for the summer, or to be able to fit in their dress for their wedding. Research has shown that this is something that people are having to take for the long haul to keep the weight off. Dr. Tony Hamilton, who is a family physician with Advocate Healthcare, mentions that 80% of the people who get off the GLP-1 gain weight back. He prefers a more natural approach, including a ketogenic diet, satiety per calorie method, exercise, and some supplements he recommends. However, what about patients who have tried all those methods and still nothing? These above weight loss approaches he mentioned have shown not to work for everyone. Everybody is different, especially with how our bodies process things. Going back to the GLP-1 being recommended to take long term, do we know if it's safe long term? It's also important to note that the long-term side effects of these drugs are not yet well studied. The answer is no, but with some of the great results I have seen from patients who are on it, I have hopes that GLP-1s are not any different than any other medication that has been around for years regarding safety taking it long term. For subtopic number 6, I will be going over the diabetic side of GLP-1s. After talking to Kate Trusselman, there are a few added bonuses to the GLP-1 versus insulin therapy. While there is not much difference in how much they lower A1Cs, both medications also have other effects, good and bad. In an article I read, it mentioned that insulin was more effective than GLP-1 analogs in lowering the fasting plasma glucose concentration, while GLP-1 agonists were more effective in lowering the postprandial glucose concentration. Insulin therapy was associated with weight gain, while GLP-1 analogs consistently caused weight loss, and difference between the mean change in body weight between the two therapies was highly statistically significant. Despite a similar decrease in A1C, the risk of hypoglycemia was 35% lower with GLP-1 therapy compared to insulin. Compared to insulin, GLP-1 analogs caused a significant decrease in systolic blood pressure and were associated with greater rate of gastrointestinal adverse events. Like Kate mentioned above, GLP-1s are not fast-acting, so if this is a situation where a patient's A1C is over 10, they will have to be on both an insulin and GLP-1 until their A1C is in a safe spot under 10. Otherwise, once their A1C is maintained under 10, we can remove the insulin and just be on a GLP-1. If their A1C is under 10 already, there is no need to take both insulin and GLP-1, just the GLP-1. Another thing that Kate touched on is SGLT2s, which is Farxiga and Jardiance, which works in a way by excreting extra sugar out of their urine to help their A1C. It seems that patients prefer GLP-1s over SGLT2s because of weight loss benefit. For subtopic number 7, I will be conducting an interview to get a patient's perspective on GLP-1s. The person I will be interviewing today is my lovely sister Amy Downey. I've always looked up to her for everything, and she has always been the first person I go to for advice. Amy has lost a lot of weight being on a GLP-1, but on top of being on a GLP-1, she is eating more healthy and also exercising frequently. She has been putting in some major work, and I am so proud of her. Let's start out by letting the audience know a little bit more about you. Do I have permission to record you for our interview today?
Yes, you do.
Where do you currently live?
I live in Arlington, Texas.
And what is your favorite hobby?
I would say probably reading and baking.
Okay. What do you do for work?
I work in accounting for a construction company.
Knowing how much you like books, how much do you normally read in 2 weeks?
Oh gosh, I would say maybe 4 books in 2 weeks.
Oh my goodness. Amy, I'll be asking you questions about your personal experience while being on a GLP-1. So first off, what made you decide to start taking a GLP-1?
I've always kind of struggled with my weight. And then the last like 8 years, I was diagnosed with some autoimmune diseases, which made it even harder to lose weight. And it was just, I'd kind of figured out how to do the things I needed to do with eating better and exercising. Still wasn't working, so I just kind of decided to try this as kind of like a helping hand.
Well, I can understand that, especially I have heard that a lot of autoimmune diseases do make it a lot harder to lose the weight.
Yes,
A
it is
lot
a
more than
pain for
people
sure.
realize.
Yes.
What or when did you start taking a GLP-1?
I started in August of 2024, so it's just a little over a year ago.
Did you try any other weight loss methods before this? I asked this question now, but you already mentioned you did. But what weight loss methods have you tried and how did it compare?
I feel like I've done everything under the sun. I mean, nothing short of like the, good old eating less and exercising. I've done Atkins, I've done Weight Watchers, I did the terrible HCG diet that was popular like 10 years ago. I feel like I've done them all, and it all seemed I mean, it was still hard work, but it all was kind of like a quick fix where I wasn't really healing like the eating part and the exercising part that I needed to work on. It was just kind of like a quick fix to lose a bunch of weight, and then as soon as I was done, then I just went back to how I was eating and before, so I just kind of gained it all back.
Right. What changes did you notice in your appetite and eating habits once you started the GLP-1?
Definite appetite suppressant. I know a lot of people say this, and it sounds cliche, but it like very much the food noise where I wasn't constantly thinking about like what my next meal was gonna be or like craving, what sounded good. Like just everything was so suppressed.
And um, how quickly did you start seeing the results from that?
I would say like that first month, it went pretty quickly. I don't know if it was just like my body kind of getting like a kickstart with it, and I think I probably lost like 10 pounds that first month.
Oh, wow.
Yeah, it was fast.
Did you start feeling better on top of it immediately, like in sense of like your health? Like, did you feel like you were more energized or anything?
Oh yeah, definitely. Yeah, for sure.
What side effects, if you had any, have you experienced on the GLP-1?
So when I first started it, I was on Ozempic, and that was kind of where I saw the most side effects. The main one that was awful was all the bloating. It was just a constant, my stomach just hurt all the time. And my doctor said that that was really a main like bad side effect that most people complained about, and so she put me on the tirzepatide, and that I haven't really had a lot of side effects since switching to that one.
Is the tirzepatide, is that one the Manjaro?
I think so, yeah. The one I'm on is Zepbound, and I believe that they're both similar.
Yes, I think they're both
Yeah,
tirzepatides.
yeah.
Um, what was the process like trying to get prescribed for a GLP-1?
In the beginning, my insurance did not cover it. And so I went through like an online app to get the prescription, and then I mean, most pharmacies it was like $1,200 because it wasn't covered, and then I found which obviously no one can really afford, and if you are, you're crazy. And so I found a compound pharmacy that would fill it for like 250 per month. So that was it really wasn't hard to get prescribed. It was just finding one that was like very cost effective.
Did you ever try the one that wasn't the compounded, or did you just go to the compounded because that was the option that was a little bit more affordable?
Yeah, I had to go to the compound route first.
Okay.
Just, cost effective for sure.
I'm only asking just because I've heard some back and forth things about the compounded version, um, like from provider or pharmacy aspect. And even from my patients, not a lot of people liked the compounded version and didn't really feel like it helped much compared to the actual FDA approved version. So I was just curious if you had it to compare to anything or if that was your first start.
I feel like in I don't know, my opinion, I felt like the compound was more effective for me, and maybe that was just because it was in the beginning of the process.
Right.
I felt like I could stay on one dose longer just because I didn't like hopping up doses very quickly. I just wanted to stay, like, I just wanted to do as like slow and steady as possible. So that may be why I see the difference where now that I'm on the one, like the actual Zepbound, it's been a slower weight loss, but it's also been after a year, so that may be part of it too.
Okay. And that was going to be my next question is if you had run into cost or insurance coverage. But you had said, I think you had told me, and maybe not our listeners, but you got the Zepbound covered by insurance, right?
Yes, I finally ended up getting a better plan through my employer, and it was covered. I just have to do like a prior authorization every year. And I think it's like $25 a month. So that's a huge, huge savings.
Oh, that is really nice.
Yeah.
I thought that the even the cost after insurance coverage would still be a lot, so that is very affordable.
Yes.
Have you noticed changes in your energy, mood, or confidence since you started the GLP-1?
I don't know if I'd say my energy or mood has really changed a lot. I do feel obviously like my confidence. I mean, I've lost 75 pounds in the last year, so I think that alone will just do good things to someone's psyche for sure.
Right.
Yeah.
What has been the hardest part about being on a GLP-1?
Kind of going back to like the appetite suppressant and like the food noise going away is I have to work really hard to make sure that I'm properly like getting my nutrients and getting the protein that I need. Because really, I'm not ever hungry, so I have to really be planning and proactive about making sure I get all like keeping my body healthy, honestly.
And what is your steps for that? Are you just making sure you're getting all the protein and vegetables and pretty much like
Yeah,
everything on the
exactly.
food pyramid that all your food groups?
Yeah, I mainly focus on lots and lots of protein and lots of veggies. Um, Because, yeah, I've heard that people, if you don't, I mean, your body's obviously not getting the nutrients it needs when you're not eating. So then, like, you start like losing hair and stuff like that because your body doesn't have all the things it needs to keep moving. So I was scared for that.
I don't blame you. Um, what do you hope for your future? And what I mean by this is, do you want to stay on it long term, or are you eventually wanting to come off, or what does that look like?
I do want to stay on it a little bit longer to kind of get to my goal weight. Um, And they recommend, like, once you come off of it, you'll kind of taper down doses, is my understanding. And then if you're wanting to, you can kind of stay on a maintenance shot, which is like the lowest dosage that you can get. So I do think that that will be my plan, just to kind of make sure that I'm staying on track and doing what I need to be doing.
Right.
Yeah.
Um, do you feel now that you're on the medication, the GLP-1, do you feel that it has lived up to your expectations of what you've heard about it?
Yes, absolutely. And honestly, it just kind of made me wish that I would have started it earlier.
Right.
Yeah.
If you could go back in time, obviously we've already figured this out by now, but would you still choose to take it? And would you skip other avenues to start taking this? Or do you think you would still want to try all the processes that you did to get to this point? Like in terms of like
Um,
what you tried to do to lose weight, like the Atkins, the Weight Watchers, all that.
I don't think that I don't mean, I am happy that I've tried I mean, obviously, besides the HCG diet, that was a terrible diet, and I don't know how that was even recommended, but I think that it was honestly healthy in a big picture way of doing the Atkins and the keto and all of that. It just kind of helped me understand nutrition and like what your body actually needs more.
Well, and it's kind of interesting that you're talking about prior to this that you have to really watch what you're eating and making sure you're getting all the nutrients because it's almost like, I mean, I know for me, if that was me, I feel like I would be almost eating better knowing that I'm trying to, you know, um, what's the word I want to use? Knowing that I want to make sure I'm not losing my hair and I still want to keep my body healthy while losing um all the weight. Like, it's almost
Exactly.
like you're focusing more on eating the better foods to stay on top of it.
Yeah, exactly. And I'm like, I'm paying to do this service, so I might as well get my money's worth also.
Right. Lastly, what advice would you give to someone considering a GLP-1?
Definitely do your research and obviously going back to really focusing on, excuse me, doing everything. I don't know if there's a right or wrong way, but the right way in my eyes as far as giving your body the fuel that it needs to. And don't look at it as like a quick fix. Look at it more of like a lifestyle change and, staying on top of that and adding in exercise. And I think that's a good equation for some good results.
I agree. So I feel like it can be kind of misleading in the media nowadays and all these celebrities that are doing it just for like a short term, like wanting to lose 20 pounds. Because I
Yeah,
feel like that's when it was
absolutely.
really advertised, and I don't really feel like that's what, like, I feel like it's more meant for people who are trying to make a healthier lifestyle,
Right.
take care of themselves, not something that they're just going to take whenever they need it to lose however much pounds they need.
Yeah, exactly. I agree.
I really appreciate you for being so open and honest about your experience because I know it's not always easy to talk about weight, health, and side effects in such personal ways. As you heard, there are benefits but also challenges to GLP-1s. Everyone's journey on a GLP-1 is different, and it's always important to talk to your medical professional before making the decision to be on a GLP-1 because there can be, especially with certain people's anatomies or diagnoses or whatever, sometimes GLP-1s aren't appropriate for some people. So always important to talk to your provider and making sure it's a good fit for you. Thank you again, Amy, for giving us a perspective of someone who is on a GLP-1.
Of course. Thank you so much.
For subtopic number 8, I will be discussing the compounded forms of GLP-1s. I have heard a lot of back and forth regarding compounded GLP-1s. Patients at the clinic I worked at were constantly asking for compounded semaglutide, with the only option at that moment being the sublingual form, meaning it went under your tongue until it disintegrated. At this point, it was very hard to find a compounded injectable form of the semaglutide around where I live. Multiple patients mentioned that they never saw any improvement in their weight, even when we had titrated up on the dose of the compounded semaglutide. From the interview above with my sister, she did notice success with the compounded semaglutide she was on. However, hers was the injectable form. Each type of compounded semaglutide or GLP-1 are not made the same. None of the compounded GLP-1s are FDA-approved either, meaning the pharmaceutical companies cannot guarantee the compounded GLP-1s are safe. Some semaglutide products sold by compounders may be in salt forms. These salt forms include semaglutide sodium and semaglutide acetate. These are different active ingredients than what is used in the approved GLP-1 drugs, and so these pharmaceutical companies are being urged to not use salt forms to make these compounded semaglutides. Compounded GLP-1s really became popular when there was a shortage in FDA-approved GLP-1s. It was a way for online pharmacies to profit from patients when there was a shortage of the very popular medication, the GLP-1s. On top of concerns for the salt forms of semaglutide they're making, we also have to worry if the compounded GLP-1s were contaminated, improperly stored, transported, or adulterated. A good point that Kate Tresselman brought up during my interview with her is the question is, where were they getting that medication if it was a shortage everywhere in the United States and we couldn't get it from the approved avenue? Where were they getting it? And was it counterfeit? And what's the legitimacy of that? I think there's probably a lot more black market stuff happening back then. But now I'd like to say the compounded products are much more regulated. However, it still begs the question, is it safe and effective? This reminds us that even if compounded GLP-1s are being sold for use of weight loss by pharmacies, it does not always mean that they are safe to take, have not been tampered with, or that the ingredients weren't being replaced with something more harmful. If it is not FDA approved, that means there is no safety guarantee for the drug, even if it is sold from a pharmacy. Pharmacies sell a lot of non-FDA approved drugs and are allowed to, meaning we need to do our own research and outweigh the benefits and risks before requesting a drug not FDA approved. To conclude, after all the research and interviews I conducted, I can say that my original perspective on GLP-1s has changed. That is why it is so important to have all the information. I specifically chose the people that I interviewed because they all had a different perspective on GLP-1s. I wanted to learn about it from all angles. The people I interviewed all had their own knowledge and experience on GLP-1s. After everything I learned from all of them, I would say I am neutral in terms of my views on GLP-1s. I have seen and heard about great benefits from the GLP-1s, while also seeing and hearing about some of the risks that it has posed. GLP-1s have great potential and researchers are finding out more benefits that are surfacing from GLP-1s. My hope for the future of GLP-1s is that there is no long-term harm to patients taking it, or at least not more than medications that have been out for years. Well, now I can say that I know more than I did yesterday regarding GLP-1s, and my perspective has changed, which I can say does not happen very often. But how often do you get to hear all perspectives on a topic? For me, not very often. Thank you to everyone who tuned into my podcast episode on the good, the bad, and the unknowns about GLP-1s. I hope you learned just as much as I did.